Hello, my name is Dan Brock and I'm a practice director here at Branchbird. I'm responsible for our healthcare analytics practice, and today I'm excited to showcase a solution we recently built for one of our healthcare customers, which leverages the electronic medical records tied up in their Cerner Millennium platform. Now, before I get started, I want to quickly share some of the pain points from this particular customer that led them to build the solution you're about to see today.
In our customer's own words, they were an immature BI shop. Any insights they hoped to get from their medical records were forced from a single data mart, which only contained structured data. And as the questions their organization wanted to answer evolved, IT was forced to make painstaking and lengthy changes to that data mart. And the feared IT backlog ensued, where IT couldn't keep up with the requests of the organization. What's more, they had no way to understand the why behind the what. They knew the medical notes, those unstructured medical notes, contained the narratives behind the trends they were seeing, but they had no way, with the tools they had in hand, to unlock it. And they soon realized that they needed a solution that provided ad hoc analysis, one that leveraged the structured KPIs as well as the unstructured medical notes. And it wasn't just one group within their health system that hoped to benefit from this solution. Their care managers wanted to find patients that needed the most attention. They had administrators who wanted to look for, the most effective treatment patterns. Clinicians wanted to understand, readmission upticks. Researchers needed to explore, find the right patients for upcoming grant applications or clinical trials. Compliance officers often just wanted to see if physicians were filling out their medical forms properly. And it was a lot of demand from personas within their organization like this that led them to this single data discovery solution on top of their medical records. So let's take a look at the solution.
So I'd like to start off by just giving a quick cockpit tour of the solution so that everyone in the audience understands exactly what data it is we are looking at. Like I mentioned, this is 3 years of medical record information ranging from January 1st, 2011 to end of December, end of the year 2013. And this data set offers us almost 6 million medical encounters, and each medical encounter is accompanied by a clinical document, aka a medical note. Across this data set and across those 6 million counters, there are 146,000 roughly patients involved in this data set, which brings to a total of 330,000 roughly admissions. And within a 30-day window, which we call readmissions, we're seeing that 40,000 of those admissions were a readmission within 30 days. So you can quickly see as you scroll down the page that first and foremost, there's just a wealth of attribution that we have about these encounters. Everything from where the encounter occurred, when it occurred, the reason for the visit or the interaction, the patient that was involved with that particular encounter, information about where in the hospital, which room and bed, which portion of the facility, so on and so forth about where in the hospital this encounter took place, the diagnosis codes and information about them that were captured at the time of the encounter, and last but not least, information about the medical note that was captured at the time of that encounter. So we're really been given all of the data and all of the attributes within the data as a way to invite us to have a conversation with the data, to remove a friction with the data so that we can kind of have an exploratory or discovery experience and kind of ask those in the moment unanticipated questions. In addition to the attribution you see we've collected here out of the EMR, we still have the granularity of the encounter. So we can come down here and see the raw medical note and read the medical notes, all 6 million of them that were collected across this 3 years of treatment. We can reconstitute the patients that were involved with this treatment across these 6 million medical encounters, and we can look at the encounters themselves. So as we're exploring, we can always get right back down to a list of patients, relevant notes, and the particulars of the encounter. So when I give this solution demo, I like to put on the hat of one of the personas we saw earlier. And in this case, I'm going to put on the hat of the administrator, who in this case is looking for reasons that the health system might be seeing an uptick in readmissions. And just at a first glance, I look across, on our admissions summary here, I know I'm really mostly interested in 30-day readmissions, so I'm going to quickly filter down and only look at those admissions that happened within a 30-day window. And what I notice is that now my total admissions and my readmissions now match, which you would expect, and we're looking at a subset of those patients. So only 22,000 patients seem to come back to the hospital within a 30-day window. And I can see that, you know, my admissions is somewhat seasonal across these 3 years. And 1 month in particular starts to jump out at me, which is February of 2013. Seems to have a little bit of a spike, and I might want to investigate why. So I'm going to actually hone in on that particular range and just look at the months that flank it so I can get a closer look at what might be going on here in this time period. So I'm going to filter down to, you know, between January of 2013 and we'll go to March, so the months that surround it. So now I've applied 2 filters. I'm just looking at those readmissions that happen within 30 days, and I'm looking at just a 3-month first quarter of 2013, and I can now see kind of a zoomed in view of what's going on here in February, and I can see that where it should be declining, I see a little bit of an uptake, and I want to explore this further. So knowing this data is seasonal, or that this particular readmission is seasonal, I might want to look into things that go on in the winter months. So in this case, I'm just going to search for flu. And right away, the solution is going to offer any of the structured information that it has in those attributes where flu matches. And I can choose to jump off or apply that filter right away. But what I find when I do refine by that structured information is that sometimes it's entirely too restrictive, which is what we're seeing here. If I pick you know, a reason for visit with flu symptoms, you can see I'm really down to just 1 patient, and I'm not really going to be able to understand a trend in the data if I'm just looking at 7 encounters for 1 patient. So that particular refinement was too restrictive. So in this particular data discovery solution where the information in the unstructured notes is able to be searched, I can cast a wider net. Instead of using the term flu to select 1 attribute where there was mention of flu, I can do what I like to call cast a wider net. I can actually search the entirety of the record, any of the structured or unstructured bits and pieces of information on that record for any mention of flu. And so when I search, I can see that, okay, now I'm looking at 170 patients and 283 encounters for those 170 patients. And that uptick in February still seems to be holding true when I'm just looking at mentions of flu. And when I get down into my medical note, I can do something pretty profound here in the world of analytics, which is actually read. I can actually see if there's a narrative behind what's going on here in February. And as I scroll down, I can quickly read some of the information that was captured at the time of the encounter. See a mention of no flu shot here, flu shot again, no flu shot again here. So I might be onto something. Let's go ahead and explore this notion of flu shots a bit further. And again, leveraging the power of fully featured search, now I'm going to actually search for the phrase flu shot. And what's more important to me at this point is not just finding flu shot and when people did have it, but when they didn't. So this is a problem of negation that plagues a lot of not just BI solutions, but data discovery solutions. But leveraging, again, a fully featured search index, I can actually apply functions to make sure that negating terms like no appear close to my phrase. So now when I reapply this particular filter and back out all my other ones, now I can rest assured that every note I'm looking at has the term no within proximity of flu shot. No flu shot right here, and every note's going to share the same. And now I can go revisit to see if my uptick in February is still true, and I can see that it is. So again, I'm going to filter down to just those readmissions, and I can quickly see that month is still a problem. So, you know, at this point, as an administrator, I might want to, you know, look at who these patients are, and have care managers focus on their care, and I can quickly filter down and see, okay, here's my list of 11 patients, but who's been here the most? You know, maybe these are the patients we need to reach out to right away and encourage them to get their flu shot, because it seems to have something to do with them coming back and seeing us over and over again. Additionally, if I so choose, I can actually go and actually see where these 11 patients call home if I want to do some aspect of geospatial analysis or understanding around what's going on here with these patients who don't seem to be getting their flu shots. Is it regional? Can I choose to filter further by neighborhood or region? And the map capability within the solution allows me to easily do that.
So that concludes today's portion of our Data Discovery Healthcare demo. Keep an eye out for additional installments where I'll walk you through other use cases of the solution. If you're interested in learning more about what you saw today or how BranchBird can help your organization unlock the insights in your medical data, please don't hesitate to reach out. Thank you.